Talking about the pelvic girdle, it is very important to understand not in terms of the bony framework, but also in terms of the uh, functional significance of the structure. And talking about the functional significance, so right now we are going to take a look at the true and false pelvis, which are not anatomical structures, but they are proposed structures. And in this, we're going to talk about the functions of the pelvic girdle. We're talking about the hypothetical pelvic inlet and pelvic outlet, which actually makes up the framework or the hypothetical framework for deciding the true pelvis and the false pelvis, as well as the gender-based differences between the pelvis in males and females. Now let's talk about the function of the pelvic girdle because it is a very important structure in terms of the osteokinetic chain of the human body as it connects the upper body or the trunk with the lower extremities. So it supports the weight of the body because it carries the weight of the body and it transmits it via the sacroiliac joint and the hip joint to the lower extremities. Similarly, when we are walking, jumping, or standing and our foot contacts the ground, it transmits the ground reaction force via the hip joint and the sacroiliac joint to the trunk and the spine. So that is a two-way function and it works as a very important central unit in the osteokinetic chain of the human body. Moreover, during walking, it moves as a single unit in all three planes for relatively smooth motion by contributing its importance in terms of human movement, gait, and walking by movements like nutation and counter nutation at the sacroiliac joint, movements such as anterior pelvic tilting and posterior pelvic tilting, lateral pelvic tilting, and as well as pelvic rotation. So these movements in all three planes make the relative smooth motion possible. Moreover, it also supports and protects pelvic viscera because it is actually the pelvic ring is actually made up of bones and it is hard and it provides the adequate and required protection from the physical insults to the sensitive viscera which are lodged within. Moreover, it provides attachment for different and important muscles as we already mentioned in the previous section in which we are talking about the bony landmarks and the important and numerous attachments of different muscles and ligaments on them. Moreover, it makes up bony portion of birth canal in females, which is a gender specific but yet very important function in terms of reproduction. Now here is a picture and you can see this rotating picture and it actually gives you a very clear idea of what we are actually referring to when we say the pelvic inlet. Even though it tells you visually what pelvic inlet is, but if you have to define it or characterize it, pelvic inlet can be described by drawing a line between two structures. One is the sacral promontory, which is the posterior aspect of the pelvic inlet, and the second one is the superior border of the symphysis pubis, which is located anteriorly. And if we join these two structures, so this structure or this hypothetical area is known as pelvic inlet, as you can see in this rotating picture. So here we have the sacral promontory and here we have the superior aspect of the symphysis pubis, and that is making up the pelvic inlet. Similarly, just like the pelvic inlet, we have the pelvic outlet, and it is once again an imaginary line or imaginary region between two structures, and the posterior structure is actually the tip of the coccyx or the tailbone, and the anterior structure is actually the inferior surface of the pubic symphysis, and this hypothetical area or the line is known as pelvic outlet. And the significance of the pelvic inlet and outlet is that it divides the pelvic space into two important functional areas: the true pelvis and the false pelvis. Now, what is the false pelvis? So it is also known as the major pelvis, and it is actually the bony area between the iliac crest superior to the pelvic inlet. So all this area between the two iliac crests, which is above to the pelvic inlet, is known as the false pelvis. And all the important thing to understand is that there are no pelvic organs within the false pelvis. Now, the true pelvis, on the other hand, is also known as the lesser or minor pelvis. Lesser because it's located below to the major pelvis or the false pelvis, and it lies between pelvic inlet and pelvic outlet. So it is present here between the pelvic inlet and between the pelvic outlet. So between these two imaginary surfaces, the area which is present is known as the true pelvis, and it makes up the true pelvic cavity. And it contains numerous special viscera, which such as the portions of the gastrointestinal tract, the urinary tract, and some reproductive organs as well. And it is also important because it also forms the birth canal, and the pelvic inlet, pelvic outlet, and the true pelvis are of great functional significance during the process of labor and childbirth. Now, talking about labor and childbirth, that brings us to a very important differentiation fact and analysis, which is the differentiation between male and female pelvis based on its functioning. So as females have to go through the process of childbirth and labor, and men do not have to go through it, so there are some structural differences between the two. So starting off, the superior opening into the pelvic cavity is more oval in females and more heart-shaped in males. Moreover, in females, the pelvic cavity is shorter and less funnel-shaped. Moving on, the sacrum is shorter in females, and once again, it is less curved in females as well. The walls are not as vertical in females, and the acetabula and the ischial tuberosities are further apart to allow a greater area in the pelvic cavity, because it serves as the birth canal as well and is important in terms of labor and childbirth. So these are some of the differences, and another difference is the pelvic arch is wider and more rounded in females. As you can see, this pelvic arch is very much further apart because the two ischial tuberosities are further apart as compared to the pelvic arch in the male pelvis. Now, the male pelvis is also known as the android pelvis, whereas the female pelvis is known as the gynecoid pelvis. Now, moving on, the area within the female cavity is thus greater than the longer funnel-shaped cavity of males because of all the factors that we discussed in the previous slide. And as you can see in this picture, it's wider and it's narrower, but it's funnel-shaped. Moreover, if as we already mentioned, that there is a difference in the size of the pubic arc as well. So if we want to visualize, we can visualize, for example, if the look at our index finger and our thumb. So the arc between index finger and our thumb actually denotes the pubic arc in females. Whereas if we talk about the arc of the index finger and the middle finger, so that denotes the pubic arc in males, but it's going to be actually like this in females and like this in males. So this is like index finger and middle finger, and this is like the thumb and the index finger. So that was all about the functional you can say demarcation of different regions in the pelvis or the pelvic girdle, such as the true pelvis, false pelvis, pelvic inlet and pelvic outlet, and the gender-based difference. And I hope you learned something new out of it, and for more lectures like this, keep on watching sqadia.com. Thank you very much.